If you've ever had the misfortune of being admitted to a hospital, you may have been utterly dumbfounded at the food that you were served as a sick patient trying to get better, or maybe it was one of your family members. You may have wondered, am I going crazy because I thought this was not the best food? Well, no, you're not going crazy. And yes, unfortunately, your hospital may be making you sicker than you already are, right? So today I'm going to share with you 5 shocking facts about hospital food. So stay tuned. We're going to get right into it. And at the end, I'm going to tell you or give you some suggestions as to what you can do to increase the quality of the food that you're getting while you're in a hospital. Before we get into it, I'm Dr. Amina, Goodwin, a physician and a health coach, and I help you get your blood sugar levels down to normal where they belong without taking more medicines. Why get normal blood sugar levels? Well, so you can have great energy for the entire day to do what it is you want to do, so that you can control food cravings and therefore avoid weight gain, especially as you grow older, and so you can live a long, overall, much healthier life. All right, well, hospital food. We are going to reveal 5 shocking facts about hospital food, starting with number 1. Well, they serve dessert with all meals. Yes, when you're in the hospital sleeping overnight for whatever reason, you're going to have dessert for breakfast, you're going to have a dessert with lunch, and you're going to have a dessert with dinner. You're probably going to have a muffin at breakfast time, which has maybe at least 12 grams of sugar. Every 4 grams is 1 teaspoon. And so you're going to get 3 teaspoons of sugar just with that muffin. And then you're going to have other things, maybe some an omelette, maybe a sandwich or something, right? Then with lunch, you're probably going to have a pie. Dinner, you might have some ice cream and sorbet. In fact, sometimes people will have 2 different desserts with whatever meal they're having. And I'm seeing this on a daily basis. Loads of added sugar. In fact, one person, I started tallying the amount of added sugar in dessert at that one meal, and it was 11 teaspoons. Normal recommendation, 6 teaspoons maximum of added sugar per day. They just had 11 teaspoons with the dessert, and so we're not talking about the other things they had, okay? Second shocking fact about hospital food is that you are going to be served sodas and or juice, right? Sometimes you will have both soda and juice on your meal tray. I saw one tray, the person had 2 small cans of soda. Each can had 22 grams of added sugar, so in total they had 44 teaspoons of added sugar just from the sodas on their meal tray, which of course is 11 teaspoons of sugar right there with lunch, okay? They didn't have any juice, but they were getting sodas with both lunch and dinner. Many times you have both a little container of juice and a container of soda. In fact, even people who are outright diabetic will get juice served. It says no added sugar, but the fact is we know that apple juice is very sweet and it is an unnaturally concentrated form of sugar compared to if you just had one apple. So beware of all the sugar, all the sugary things. When the first time I actually saw a patient being served soda, I was stunned, because I always know soda is not a good, it's junk food basically. And so to see someone in hospital being given a soda, and to be given a soda with every meal every single day while you're there, you can imagine how negatively that impacts your health, okay? In fact, in some hospitals, the patients do not have access to water unless it's tap water, because I remember asking a patient once, and in fact the patient tried to order bottled water with the meals, and they were not able to get bottled water, if you can imagine that. And the only access to water would have been if it was taken from the pipe, caught from the pipe by the nurse, unless they had a family member who could bring them some bottled water. Really very tragic. Third shocking fact about hospital food is that you're going to get ultra processed food. So we talk about how most of the food you should eat should be naturally occurring food from the land and the sea, and you should have much less of those foods from the factory. Well, unfortunately, in the hospital, you're going to get a lot of food from factory. Now, you'll get some fruit, some fresh fruit and maybe some salad, but predominantly it's going to be refined foods from the factory. You're going to have powdered mashed potatoes, you're going to have powdered eggs for your omelette, and you're going to have meat that you cannot tell what type of meat it is. So many times you see slices of meat, you ask the patient, what kind of meat is this? They cannot tell by looking at it what type of meat it is. Many times I've seen that, okay? We know, of course, some of these processed meats, they have sugar added as well as other artificial flavors. So really unfortunate to have all these processed foods where we know that they supply nutrients very rapidly and in a very unnatural form. They overwhelm the liver terribly and overall negatively impact health and recovery. Fourth shocking fact about hospital food is the fact that, you know, in addition to the processing, some people unfortunately need supplements, meal supplements, either to supplement the regular food, or some people just cannot eat normal, hard food, and they need liquid food. Now, if you look at the ingredient, if you have access to the ingredient for some of these liquid meals, you will see that they are essentially a concoction of chemicals, clearly from a chemistry lab. They concocted all the different things together to add up nutrients to make a certain amount of calories, and then they have the, of course, factory supplied vitamins, and it's just a big chemistry, well, maybe you won't say experiment because it's been done already, but it's essentially a creation just to check the boxes of the amount of calories and vitamins and minerals. Not natural in terms of how you access food. Yes, it might tick all the boxes, but because it's not in the usual matrix of how food should be supplied, it is not going to be very supportive of your metabolism and your overall use of energy and storing of energy. Okay, so beware the meal replacements that hospitals provide you. It's going to be a concoction of things. In fact, if you look at the ingredients too, you will see that a lot of times to make up the macronutrient fat, they will put canola oil and other of these inflammatory oils. You will see maltodextrin, which is a very, very refined starch, which has an even higher glycemic index than sugar. And then you will see a lot of gums, which are fillers to help make them a little more smooth and pleasing to the tongue. So just a very serious concoction of chemicals, really, that can negatively hurt your health. And then the fifth shocking thing about hospital food and nutrition is the fact that oftentimes you are going to see people who are being fed via a feeding tube. They are going to be fed around the clock, 24 hours a day. The first time I saw that, and it still boggles my mind how it can be normal or okay to feed somebody 24 hours around the clock. The body is meant to have a break of input of food, nutrition. There has to be a break so that the liver can recover, the body, the cells can replenish and recuperate from all the work of processing the food that is introduced. And so for somebody to be fed 24 hours a day, have food trickling into the stomach by these feeding tubes 24 hours a day, 7 days a week, and 52 weeks a year. I mean, that boggles my mind, but that unfortunately is what happens with people who are usually people, stroke patients and other patients who live in nursing homes, and they're fed by feeding tubes, and they're fed 24 hours a day. Not a natural physiologic way to be nourished. Okay, so okay, you might think, oh my goodness, this is gloom and doom. It's not gloom and doom if you actually go out of your way to question what is given to you and make specific requests for the types of foods that you want. You can, say you don't want all the juices. You can really, really strongly request that somehow, some way you get water, all right? And, if all else fails, some people fortunately are able to get somebody to bring something for them. When I was in the hospital having my son, there was just nothing. They would give, I think I got a salad, but there was nothing, no well-balanced meal that I could get. And so I just had to get my husband to bring food for me. Okay, yes, I know some people don't have anybody to bring food for them, but you can just go out of your way to ask for salad. You can reject the desserts that you're getting. You can ask for double portions of regular food, double portions of meat, and reject the juices, and instead ask water. Like I said, reject the dessert. In fact, a patient recently somewhere else, and he said he started to not take the dessert that they were giving him, and he ended up losing more than 10 pounds just being in the hospital for a few weeks, right? So there are things you can do. In fact, I think if more people push back and more people demand healthier foods, then the dietary departments of these hospitals will have no choice but to supply healthier options for people. All right, so this is all I want to say about this. I want you all to let me know, have you had have you had an experience where you've been served shocking foods in the hospital, making you question, hey, have I misunderstood what healthy food is versus unhealthy food? Please share your shocking hospital food experience with us in the comments below. And I thank you for watching, and we'll see you on the next video. Bye.